My grandfather was a physician, and he was born as an enslaved person. He died long before I was born, and both of my parents, they were in kind of service occupations. My mother was a teacher, my father was a firefighter. And so I kind of grew up with this expectation or feeling that I would also be in such a profession. While at Harvard, I embraced the political atmosphere of the day. I was part of the Black Students Association. I was participated in a voting rights exercise, if you will, in Alabama, and a number of activities. So those things inspired me, and of course, opposition to the Vietnam War. However, I'm also a practical person. I knew I needed some sort of a job, and I saw medicine as a career that would allow me to combine an interest in science and an ability to serve others, especially communities of color. And so that was what drew me to medicine. Along the way in college, I worked at Planned Parenthood over the summers. And I saw what a difference that kind of an organization could make. And I saw healthcare delivered by a team of professionals, nurses and physicians and social workers for those who needed it. Columbia Medical School had an affiliation with Harlem Hospital that was fabulous. And we were in all sorts of areas of New York City. And so I just loved that varied exposure to all sorts of patients. When I went to OBGYN, I saw a team spirit around making sure that a healthy baby would be delivered at the end. And I saw the outpatient care with some of the physicians having a more long-standing relationship with their patients. So I chose OBGYN. It seemed like a good fit for me. And I quickly saw that obstetrics, while it's exciting, it was not a lifestyle that I would necessarily want to pursue for the rest of my career. And so being drawn to this new frontier, cutting edge specialty, that did inspire me. So I applied for a fellowship and thankfully was accepted at University of California, San Francisco. And again, had the opportunity to be there kind of on the ground level when in vitro fertilization started to take hold in the United States. UCSF really is a premier research institution in the United States, and the Department of OBGYN has for many years been a standard bearer. A big part of my career, and especially the last decade or so, was spent working on issues related to having a more diverse workforce, academic workforce at our university. I did research on mentoring interventions. I worked a lot with groups that were trying to address inequities in admissions practices, not policies, but practices. And I continue to do that kind of work. And one reason is because we still see outcomes that are different based on race, based on where you live, based on your socioeconomic status. And those things are morally wrong and societally problematic from all sorts of reasons. And that's one thing that kind of drew me to Rochester, which has a tradition of something called a biopsychosocial model of medical care. They've had that tradition for many years, and that's at the core of our medical school curriculum. It's not just the biology, of course you must understand that, it's also the patient's own psychological framework, and it's the social circumstances in which they live. And you have to put all those things together if you're going to successfully care for them. Because you need to get to know different kinds of people on different levels if you're going to take care of them. And so to include a kind of social justice lens is something that I'm seeing among all of the professional associations and in the journals, and that I think is very important, can help foster humility. I have, along with some mostly people who were classmates, started an alumni association for people who were part of the Black and Latin Students Organization while they were in school. And that is very important because it helped us to feel a sense of community while we were there. It helped us to really survive some of the, microaggressions that are present in practically any medical school setting, but some that are especially prevalent for students of color. And it helped, I think, and it does help us to have an affinity with some of the problems that our patients and our communities have in particular, such as health disparities. And so I really do have hope with this next generation, not just of Columbia students, but students in general, because I really see their excitement and their savvy and some of the skills that they bring to the table with a different worldview. I do think that I've changed some lives, and I'm very proud of that. And I believe that I've changed the lives of some of my patients, some of my students, and that always makes me feel good, and some of my colleagues. So I do love to hear that I have, in some ways, at least stimulated some people to think differently or to become a more conscious human being in terms of the needs of others and ways that we can better our society.